Thousands of people across the globe die each year from breast cancer complications. But what is shocking is the lack of awareness and myth that still gets associated with this deadly disease. A warm welcome to today's edition of Hude right here on the Hude Network. I am Blessing again.
And I am Jennifer again, so thank you for joining.
Well, today on Hude our stories revolve around breast cancer, including poverty, sociocultural barriers, among others, limit access to breast cancer treatments in sub-Saharan Africa. Alcohol consumption responsible for almost 40,000 new breast cancer cases in the EU region. And finally, the WHO says over 35 million new cancer cases predicted in 2050. Details in a moment. Breast cancer, like other deadly cancers, is set to account for 12.5% of all new annual cancer cases worldwide, making it the most common cancer in the world. According to the WHO, breast cancer occurs in every country of the world in women at any age after puberty, but with increasing rate in later life. Breast cancer, a disease in which abnormal breast cells grow out of control and form tumors if left unchecked, can spread throughout the body and become fatal. In 2020, there were an estimated 2.3 million women diagnosed with breast cancer and 685,000 deaths globally. As of the end of 2020, there were an estimated 7.8 million women alive who were diagnosed with breast cancer in the past 5 years, making it the world's most common prevalent cancer.
Breast cancer mortality changed a little from the 1930s through to the 1970s, when surgery alone was the primary mode of treatment, radical mastectomy. Improvements in survival began in the 1990s when countries established breast cancer early detection programs that were linked to comprehensive treatment programs, including effective medical therapies. Female gender is the strongest breast cancer risk factor. Approximately 0.5 to 1% of breast cancers occurs in men. The treatment of breast cancer in men follows the same principles of management as for women.
Let's take a look at breast cancer and see how we can get away through it after the break. Thank you for staying with us. And now let's begin our stories from sub-Saharan Africa, where prevention and treatment of breast cancer is a pressing public health issue. The WHO says breast cancer survival rates 5 years after diagnosis stands at a dismal 40% in sub-Saharan Africa, as compared to over 90% in most high-income countries. Countries with successful reduction in breast cancer mortality rates show instances of patients diagnosed at an early stage when the disease is more likely curable. However, the WHO says in sub-Saharan Africa, late-stage diagnosis and inadequate access to quality breast cancer care leads to high death rates. Most women are diagnosed at advanced stages when treatment is difficult, costly, and less likely to achieve a cure. The many barriers to accessing quality breast cancer treatments in sub-Saharan Africa, according to the WHO, include paying out of pocket to access care, which routinely results in catastrophic health costs and financial hardship for families, leading to treatment delays that make treatment less effective, and sociocultural barriers that further limit access to cancer treatment, worsened by cancer myth and widespread stigma in Africa. The WHO Global Breast Cancer Initiative, that is GBCI, strives to address barriers to early cancer diagnosis through its 3-pillar recommendation of health promotion and early detection, timely diagnosis, and comprehensive breast cancer management. While at it, the WHO also supports governments to provide centralized services for breast cancer to ensure that 80% of breast cancer patients undergo full closure multimodality treatment. WHO aims to reduce global breast cancer mortality by 2.5% per year by 2040. All right, we're talking about breast cancer, and we cannot take away the fact that breast cancer is a very, very deadly disease, especially in sub-Saharan Africa, because there's a very high mortality rate. Even though the highest cases are not in sub-Saharan Africa, there's a very, very high mortality rate. Why? Because most diagnoses of breast cancer in sub-Saharan Africa are done 5 years after one has lived with the disease. I think it's a very, very big problem. How does one stay with a disease for over 5 years before it gets diagnosed?
I don't think people recognize how absurd it is that you are living with something that it took 5 years to diagnose, because it shows that there's a problem somewhere. It could be in the healthcare system, it could be with you, it could be other issues that affect sub-Saharan Africa. I'm talking about cultural beliefs.
Yes.
But let's start with poverty. Most of the reasons why people, don't have access to, healthcare, better healthcare, is because they cannot afford it. Now we're seeing that the reason most of them can't afford the treatment, and even when they can, afford to go for diagnosis, they also cannot pay, for the the essential treatments afterwards.
Therapy and all that, yeah.
And then now we're seeing that cultural abuse is a factor, because this has been an issue that has been affecting Africa for a while. The fact that most of our beliefs are still surrounded by that you have lumps on your breast, they'll tell you maybe something you did in the past, pray about it.
Exactly. And this particular thing has killed a whole lot of people.
Yeah.
Because imagine you don't feel good, you feel discomfort, in abnormal places. Instead of you to probably go and say, oh, I need to get a checkup. Or after checkup, you follow up for treatment. You say, oh, I've prayed to God. I'm not disputing the fact that, oh, miracles could happen.
Yeah.
But I think we need to take it serious in this part of the world. The fact that science is here to help us. I mean, especially when it has to do with our health, we have to prioritize taking care of ourselves. We have to prioritize getting treatments in the right way, not just living into some cultural beliefs and religious beliefs. Do you understand what I'm saying? Because
100%.
you can't be sick and expect a miracle without treatment.
Is it not God who help those who help themselves?
Is it not God that gave men the ability to, come up with such things?
Yeah.
So I'm particularly sad about the fact that we're at this point. It's not like we do not have the information, but then, yes, there's still a limit to the level of information we have. So I think we need to do more. Keep away some sociocultural beliefs when it comes to your health. Keep away some religious beliefs. Just go for treatment. Well, if it's poverty, then that would be a completely different ballgame.
Yeah.
But then if you have access to everything that could help you, please do your best to, help yourself get better.
I also believe the government too needs to do their own part, because see the numbers, see the statistics, 685,000 deaths globally as of 2020. There were still 2.3 million women being diagnosed yearly. And it's like, with all of these numbers, why don't we have adequate healthcare facilities for this?
Exactly.
Like, why do we not have oncology centers that focus basically on cancer?
Another thing is, do we even have the specialists? Because, there are statistics that say in Nigeria, not in Nigeria now, in this part of the world, sub-Saharan Africa, it is hard that one goes to the hospital and then they get diagnosed at their first, say meeting with the physician or something. It takes 2 or 3 times before they eventually get diagnosed. I wonder why. Is it because we do not have adequate specialists, or what are the reasons? Is it because there are not enough equipment? Just like you say, the government has a very big role to play in this. In fact, even when it comes to the poverty, they should make some of these things, accessible to the poorest of the poor.
Yeah.
Make them cost effective, and hopefully we'll get a way through to this. But one basic thing I'm sure we need in this part of the world is adequate information.
Yeah. Anyways, we'll move now to the next news story, where breast cancer is the most frequently diagnosed cancer type in the World Health Organization European region, with 1,579 women diagnosed every day. Alcohol consumption is said to be one of the major modifiable risk factors for the disease, causing 7 of every 100 new breast cancer cases in the region. During Breast Cancer Awareness Month, WHO encourages everyone to understand that the risk of breast cancer can be significantly reduced by simply reducing alcohol consumption. The World Health Organization European region has the highest rate of new breast cancer diagnoses compared to any of the other WHO regions. According to estimates from the International Agency for Research on Cancer, IARC, in 2020, alcohol consumption was responsible for almost 40,000 new breast cancer cases in the region. According to the WHO, there is no safe level of alcohol consumption. The risk of breast cancer increases with each unit of alcohol consumed per day. More than 10% of alcohol attributable cancer cases in the region arise from drinking just 1 bottle of beer, which is 500 ml, or 2 small glasses of wine, 100 ml each, every day. The WHO further states that for breast cancer, The risk in such an amount of intake is even higher, as 1 in 4 alcohol-attributable breast cancer cases in the region is caused by this amount. In a bid to reduce alcohol harm in the region, the WHO European Programme of Work 2020 to 2025, EPW, and WHO Europe's United Action Against Cancer Initiative recommend making alcohol less affordable, banning or restricting alcohol marketing across all types of media, and reducing alcohol availability. The WHO further recommends that all countries of the region place health warnings on the labels of alcohol beverages so consumers can easily make a good decision while choosing what to drink. Breast cancer. I mean, this is the first time I'm saying something that, does not directly affect the African region.
It does. Well, the very high mortality is here, but then the higher
the
cases
case of alcohol consumption, we're looking at the European region.
Yeah.
And see that the WHO has recommended, a lot of things that can actually help in reducing breast cancer. But now we're talking about alcohol. And for a place that, they use alcohol to celebrate a lot of things, we see that now they're not even saying do not reduce the intake of alcohol. They're telling you don't use it at all because it has caused a lot of problem. It's responsible for 40,000, diagnoses yearly. And it's like, if they have told you about this, why then are people still drinking alcohol?
Why then are people still drinking alcohol? That's a big question. I feel we should make the fact that alcohol intake, regardless of how little, because it is said that more than 10% of alcohol attributable cancer cases in the EU region arise from drinking just 1 bottle of beer or 2 small glasses of wine every day. So it's not even about the amount. I can't say, okay, just reduce it to, very little. It doesn't work. It has to be that you stop it for the sake of your health. Because tell me why alcohol is responsible for 40,000 new cases in the EU region. Now, we're not talking about alcohol being the only risk factor for breast cancer, but in the EU region, it tops the chart because 40,000 is a very, very big number.
Yeah.
And just like you said, imagine they are celebrating World Cancer Month or World Cancer Day and they are saying, oh, let's raise glass. A glass of wine or a glass of beer. You don't know that this glass is doing more harm to your body than good. You're creating awareness that, breast cancer is curable, breast cancer can harm your health, you need to do better, but then that one glass you're raising can really, really affect your health more than you can imagine. So for that region, I think they are exposed to some high level of equipment, if you ask me, facilities that aids treatment and all of that. And probably that's why they do not die so much from it. I'm not saying that there's no mortality rate there, but then the mortality rate is highest in the sub-Saharan African region. There, they are exposed to good facilities. Well, I can't say how much the cost effectiveness is there, but then at least for the fact that they are exposed to it, they have access to it, it means it can come easily. So regardless of the fact that they have the treatment and all of that, they need to reduce how much cases they get.
Yeah, and in as much as we say that women have the most cases of breast cancer. Men too, they get it. Abuse rare, but it's still there. So
yes.
The alcohol reduction, or in fact, no intake at all, applies to both genders.
Both genders, yes. But then, yes, it's higher in women because in men it's just 0.5 to 1%. Yeah, the tendencies. But then it all goes down to saying, regardless of the information you have, you need to protect yourself from some of these little things like alcohol, because I'm sure they're well informed in that part of the world. In Europe, definitely they have access to information, they have access to treatment, and well, it's a developed region.
Yeah.
So maybe the poverty rate won't be as much as it is in sub-Saharan Africa.
There's access to better facilities.
Exactly. And well, they are surviving. Some of them go through several chemotherapies and they end up coming out good. So it's a good thing. But still, you need to do better. Reduce intake of alcohol and hopefully we'll get it done and better and reduce the cases in the EU region. Well, now it's time for a very short break. When we come back, the stories continue. Please stay with us. Welcome back to Hude Hour, and now for our final news story. Let's take a look at the projected cancer burden increase in 2050 as stated by the WHO. Over 35 million new cancer cases are predicted in 2050, a 77% increase from the estimated 20 million cases in 2022. The rapidly growing global cancer burden reflects both population aging and growth, as well as changes to people's exposure to risk factors, several of which are associated with socioeconomic development. Tobacco, alcohol, and obesity are said to be key factors behind the increasing incidence of cancer, with air pollution still a key driver of environmental risk factors. In terms of the absolute burden, high Human Development Index countries are expected to experience the greatest absolute increase in incidence, with an additional 4.8 million new cases predicted in 2050 compared with 2022 estimates. Yet, the proportional increase in incidence is more striking in low HDI countries, with a 142% increase and a 99% increase in medium HDI countries. Likewise, cancer mortality in these regions is projected to almost double in 2050. Reacting to this, Dr. Freddie Bray, head of the Cancer Surveillance Branch at IARC, says the impact of this increase will not be felt evenly across countries of different HDI levels. Those who have the fewest resources to manage their cancer burdens will bear the brunt of the global cancer burden, and those with higher HDIs will bear the lesser burdens. Well, this prediction scares me, to be honest. It's really, really scary that by 2050, we're expecting a 77% increase. Now, that is not just any prediction. It's from the World Health Organization. So you know that we need to really, really look into these issues. And, they mentioned some factors, including alcohol, tobacco use, obesity, air pollution, all as being risk factors for cancer, breast cancer. So we need to actually look at these and get better.
We've had cases of, we've had series of development goals, where they project like they want something good to happen. And then now we're seeing that for breast cancer, the projection is going to be worse. And for factors that can be avoided. Now we're looking at alcohol consumption, we're looking at, poverty, we're looking at air pollution, obesity. These are things that if we work on, we can actually beat this projection.
Yes.
But then for them to still project, like for them to still put it there, it means that, people are not really like willing to do the work. And it does not just affect the people that have breast cancer. Their families too will bear the brunt of it because they have to pay for it.
Yes.
And now in high development index country, that is, people that it depends on the kind of income you bring into the country. But looking at low income countries, low HDI, which is the country's average achievements in three basic aspects of human development: health, knowledge, and standard of living. Now, I think that low HDI countries would have a 142%, projection rate, and they will have it worse. They will get it worse than the medium HDI that is 99%. Both are still worse, but look at what the percent that is being attributed to low HDI, regions.
It's a big deal because the truth is the poorest countries will actually be affected the most.
Where?
If your HDI is low, like you said, there's a big difference. So if we're talking of low HDIs and medium, means, okay, the medium, they're probably doing well, trying to be balanced, and their standard of living is quite manageable. But then for the low, over 100%, 142% is expected to increase in cases. If it increases in low HDI countries like that, that means the mortality rate is definitely going to increase.
Yeah.
Because these countries do not have what it takes to battle this disease. Well, for now, the only thing we can do is take the information to the ends of the earth. Yeah. And I guess we're doing our bit, but then we need to do more to the rural areas, to the women who don't really know what this breast cancer is all about. We need to do our best to take this information to them. And the government needs to do a whole lot when it comes to this, because by 2050, well, let me save that thought. By 2050, I hope we're able to deal with this and not get to this WHO predicted, number. Because if we get there, it's going to really, really, really be a big deal. But then now to drive our conversations further and to look at how we can probably, take this information to the ends of the earth, we'll be joined by Blessing Balogun after the break, and she'll help us drive this conversation. Please stay with us.
The first season of Timeline is on. The journey so far has been amazing and impactful. The world needs change agents. The world needs me, you, and all of us. Join me on Timeline as we continue to share important information and discuss social issues that would help someone out there. Let's continue to advocate for critical changes on issues affecting our world today. And together, amplify messages that provide answers to burning questions. Our journey continues as we create awareness and promote shifts in health matters and other social issues that will alleviate personal and communal struggles, guided by international laws and best practices. Join me on Timeline exactly 7 p.m. every Friday on Hude Network's YouTube channel. Subscribe, like, and turn on the notification button. You can become an agent of positive change by dropping your comments in any of our episodes as a contributor or as a professional. Join the conversation respectfully.
Thank you for staying tuned on Hude R. And now we're being joined by Blessing Balogun, who is a public health practitioner. She's here to help us look for a way forward through this menace, breast cancer. It's a pleasure to have you join us.
Thank you, Blessing, for joining us.
Thank you for having me here.
All right, so let's go straight into the business of the day.
Okay.
I can't smell talking about this because this issue has eaten too much food out of our plates.
Sure.
Now, breast cancer has been here for the longest of times. That is true. Breast cancer has been killing a lot of people for the longest of times. That is true. But then the statistics make me want to wonder why the mortality rate is highest in sub-Saharan Africa. Can you just give us a brief on or your take on what you think could be the reason?
Okay, so why it's more prevalent here in the sub-Saharan Africa is because of a few factors, So one of them is poverty, because treating breast cancer or any form of cancer at all is actually not cheap because you have like stages to go. And then also finding out how, if a person actually has the form of cancer is not actually cheap as well. Because when you go for checkups and consultations, you have to like pay, right? And it's not everybody that can afford it. Because if you look at it, the rate of unemployment is alarming, in this part of the world. And then you don't have also infrastructures, that's like health infrastructures that cater for cancer, to be particular, you understand? And that is also another issue and reason why it is a problem here, because even the people that can afford it, they don't have where to go to for these treatments and checkups. Do you understand? And then we also have lifestyle, and then we have culture and beliefs. Some people don't want to be associated with the stigma of, oh, she has breast cancer. And in this part of the world, we hold on to beliefs more than what we can actually see.
Yeah.
Because when you see someone, I would say, okay, for instance, the person has breast cancer. It is now a stigma. It's like the person has a disease that is going to just spread and then kill everybody.
Yeah.
Instead of, okay, now we know that there are things you can actually do to, take care of a patient that has breast cancer. Why not just do that? But no, in Africa, it's either you see people go herbal, that's getting leaves and going to their village and their grandmothers, giving them things to drink without even knowing, okay, what is the root cause of this problem? So for breast cancer, there's lack of or insufficient awareness for the rural areas. Not all of them know. And because of the risk factor, because you being a female is already a risk factor for breast cancer. And then talking about the age as well of having the cancer. Once you've passed puberty, you are already at risk of having breast cancer. So these are some of the things that makes breast cancer prevalent here in Africa. There is insufficient information, especially in the rural areas, because they are not aware of these things. And then infrastructure, health infrastructure, there's no particular structure to cater for cancer cases, you get. And then there's poverty as well, and then cultural beliefs.
No,
All right.
Just search you.
You mentioned lifestyle.
Yes.
But how is lifestyle, a reason why breast cancer is thriving in sub-Saharan Africa?
So lifestyle, I mentioned lifestyle because, one of the major risk factors of breast cancer is alcohol consumption and, tobacco as well. So in this part of the world, whether we like it or not, people take beers, people take alcohol a lot. Some of them, sometimes it's like a relief system for some other people, maybe after a stressful day or after going out and then they just come back home and then you see, my guys, come, let's just hang out, and then they're taking beer. You understand? So for us here, why I said risk lifestyle is, a factor that affects cancer here.
Yeah.
It's because we consume alcohol a lot, whether we like it or not. We consume alcohol a lot. And then if we don't cut down on that, it's obviously going to increase, because now you're taking these things and you don't even know you have it. So you are continuing in that part because you don't, first of all, you don't know you have it. And then it's now like 5 years into the cancer and it must have really spread or increased. And then that now makes it even worse because now it has gotten to the stage where you have to now go for chemo. It's not just taking medications alone. You now have to go for chemo. You have to do radiation therapy as well. And that is expensive. So now you don't have the money and you have the problem. How do you deal with that?
All right, so just to follow up on this issue of alcohol, statistically proven that the EU region has the highest cases due to alcohol consumption. Yeah, I'm not saying we don't consume alcohol in Africa, but the EU region, it has a higher, 40,000 cases are attributed to alcohol in the EU region. But in this part of the world, in sub-Saharan Africa, things like poverty, like you mentioned, were given as reasons. Now, being that we're in a position where maybe lifestyle is not necessarily our major problem, what do you think can be done to, provide solution for a major problem, which you highlighted as probably lack of information? How do you think we can give targeted information, spread out the news to people, especially in rural areas, like you said, for them to be able to know that, oh, breast cancer is not a death sentence. Breast cancer is not like, it's not something that will kill you the next day. You need to know, what happens to your body. How do you think we can do that, especially for people in rural areas?
Okay, so I would say that, for people in the rural areas, first off, the health sector of the government have to be intentional about passing out information to those people. And in this part of the world, I'm very sure we have a lot of NGOs that are doing great works concerning cancer and every form of cancer, and even breast cancer inclusive. So the health system can partner with these NGOs. You understand? Partner with them so they go into the rural areas to educate these people. And also, you can go to schools, because once a girl child has passed puberty stage, she is prone to having cancer. So you can go to schools and educate these children first of all, so we can meet them early. There's something about, educating the child early enough, because then they now are aware of this issue. So once you can educate them early, for those that are already advanced, go into the communities. They have unions. Through those means, you can meet women and educate them, on the issues, the risk factors, and how they can prevent these things and identify, okay, who has this early and who doesn't. They can also have, community medical outreaches where the women can come and then get free medical examination, not the whole treatment now, but free medical, examination for them in their communities. So once you see anybody that is at risk of it or already has it and it's like the early stage, then medications can work. So you don't have to now go through the whole radiation and even removal of the breasts entirely, which we don't want that. So meeting them early would be preferable, and it would help us tackle breast cancer and identify, because now why we have more mortality rate here in Africa is because They don't know. In 5 years into the illness, they are not even aware. So imagine if we go through, the communities to meet them and then have this screening done for them free of charge. We would be able to detect the disease early enough to tackle that. So when you identify this early enough, mortality rates would reduce.
All right.
Well, the WHO projected that there'll be a 77% increase in terms of breast cancer cases, and they said that countries from like the higher development index that have the low HDI and the medium, they would bear most of the brunt. What do you think about that?
So the same thing I was saying, because the whole treatment for breast cancer is expensive. We can't take that out because the materials, the equipment, these things are expensive. You understand? So if we can get this early, we can bridge that gap.
Yeah.
If we can identify it early enough, we can bridge that gap. Because then you wouldn't, because if someone has breast cancer in a family, obviously the whole family would want to come together to help. That is the ones that can be informed, not the ones that want to go, okay, their beliefs, don't start drinking holy water and all of these ridiculous things. But once you get it early, you wouldn't have to spend so much, in quotes, put out of the quotes, that you wouldn't have to spend so much to cater for the breast cancer, because once you're doing just chemo and then taking your medications to prevent the spread of the infection of the cancer in that particular area, you don't necessarily have to now go through radiation and surgery where you have to now remove that. That is another cost on its own. So if we can bridge the gap, I don't think that prediction would now. That is a way I feel you can bridge that gap so that the WHO predictions will not now come into actualizing.
All right, thank you so much. My next question is sort of dicey, but then, okay, now as a public health practitioner, we've identified superstitious beliefs or some form of cultural norms or stigma as being one of the reasons why breast cancer is thriving in this part of the world. Now, as a public health practitioner, what do you think we can do, to combat these very, very strong issue? Because it is strong in this part of the world. So what do you think are the key steps we can take as individuals? What do you think the government can do as a body? What do you think everyone else can do to help, combat this issue of stigma, superstitious beliefs when it comes to cancer or breast cancer particularly?
Okay, what I think the government can do. First, I'll start from the government and
Okay, all right.
About it. So what I think the government can do to tackle this is to make sure we have lockable infrastructures, health infrastructures that actually work. You get? Because now we have an issue where we actually don't have enough physicians, and then even the ones that we have are trying to leave the continent as a whole, because they feel like the economic situation is not working out for them.
Sure.
So now what I feel the government can do is, once we have these physicians, pay them well so they can do their job well, because that is one of the issues they have, like the physicians have in the country or in the continent. Pay them well, let them have, let's have enough physicians on the ground first. And then we can bring out laws that protect these people. You get? And then we can now work on building infrastructures, cancer centers where people can have access to. And then we can also make subsidy for healthcare. In some areas, I don't think all the countries in Africa have like specific cancer centers. So we can start by building this infrastructure. We can start with one, per country, and say, okay, this is a center that deals with cancer, and then breast cancer is, part of it. Now we know that, okay, we have structure, and then we have the physicians that would cater for these people. Then we can now say, okay, now the work now is to us. Let's now go out and make them aware, tell them, give them information that you can come here for screening. You can, we have centers, we have physicians that will cater for you. You don't need to be afraid of, no, no. What if the partner takes lights when they are doing the red? All of that, we have cut that out. Okay. So now we have the structure, we have the physician. So now we now have to go out and educate these people. First off, breast cancer is, one of the cancers that as a young person, as a young female adult, you can, sometimes do the screening yourself. So these screenings that you can do by yourself in your house, we can, go out and educate these people and show them, illustrate the ways they can, carry out the screening on their own. So when you now notice anything, you notice any work, you know where to go to now have a proper screening done. So now the things that we can do as, a continent, as people, as individuals, create structures, how we need to, invest in our physicians, and also awareness. Awareness cannot be overemphasized actually, because we need to tell these people, communicate with them at their level. Don't come and start speaking plenty Gawai, and then they're not like, what are you saying?
Yeah.
Do you get? So go down at their level. If it's to speak their native dialect, do that. Have somebody that you've trained that would, go out and talk to them in the language that they actually understand. So they know that, okay, this is not child's play. It can actually take your life. You get? So we need to awareness. Awareness is something, and if with individuals as well, not just the government, NGOs, individuals, we can come as a group, go out and make awareness. Because I remember when I was, in the university, an NGO came to our school to actually they came for breast cancer awareness.
Okay.
They brought a chart where you would see how to actually do the screening yourself. So these are the things that we can do as individuals and, as organizations.
All right. Sorry. So, in situations whereby awareness has been done, people are aware that they should go to the hospital. But then, like, the cost is the problem. Because I saw something that they withdrew, the drug that was meant for treatment of breast cancer in Scotland because of how expensive it was. What can the government do, or even individuals do, to mitigate these costs?
Okay, so I know that right now, at least, I know they have this NGOs. That's where NGOs actually come in.
Okay.
First, we need to, give the government reasons why. Because the government right now, nobody wants to do anything without a reason. So that's why we have NGOs to, give the government reasons why they should subsidize this treatment.
Mm-hmm.
And also we have NGOs that specialize in, helping out the individuals with this situation with their finances. That's their job. It's just to help them out, to subsidize also payments for these things. So once we have that, once the government, subsidized, we have subsidized treatments, and also we have NGOs that are willing to also help and assist individuals with breast cancer in payments of their medications, radiations, and all of that. And the individuals also, governments also have to now create jobs for young people, create jobs for, it doesn't matter how little they are being paid, but once they know that, okay, they have jobs, that would also bridge the gap, because I know organizations right now, they have health insurance. You get? So health insurance also would cover a part of it, which would now also assist in, the cost effectiveness.
All right, thank you so much for being with us. But just before you go,
Okay.
you've given us so much already. But then in a situation where everything has been done, the government has done its part, the people have done their part, NGOs have done their parts. Now, how do we tackle religious beliefs of people who would rather pray to God to get healed? As a public health practitioner, you probably are familiar with some of these things where someone is not okay, but they would rather pray and, take the holy water given to them, like you said earlier, by their pastors or something. How do we handle these things? How do we speak to people to tell them that catering for your health, taking care of your health is not necessarily against your God? How do we do that?
Okay, so personally, I am not against praying because I'm a Christian, so obviously I pray. But God has given us different avenues. You know, she is the one that brought these physicians. You get everything that we have was given to us by God. We didn't just wake up to start doing anything. It was given to us by God. So first of, we need to understand that these physicians are here. They went through the training because God gave them the idea to do these things.
Yeah.
So it's not like you're going against God. It is not a sin. Because even some pastors will tell you, if you are feeling sick, pray, but still go and get your medications.
Yeah.
Go and find out what is the issue. Take your medications. While you are praying, you are taking your medications. That will now work hand in hand to help your condition get better faster. So don't rely on, your holy water and whatnot. Don't die for nothing. 'Cause if you now go and die, God will ask you, why didn't you use the help I gave you? And He has given us everything in our hands. Like, so why didn't you use it? Why you now coming here and you're crying that you die? Because I did not pray before this. So I feel like this is the conversation that would happen between the person and God.
Alright.
So He has given us all of these things. Let's take advantage of it. Don't believe in God, yes, but don't say you would now not regard the help He has provided for you just because of that. Because He actually provided this help for you.
All right, thank you so much. It's been amazing having you sit with
Thank you
us
so much.
today. I believe the conversation was very enlightening,
It
Jennifer.
was very enlightening.
All right, thank you so much. We hope to have you join us some other time.
I'm so very excited too.
All right, thank you for staying tuned. We're now going on a very short break. When we come back, we'll hear what key players in the humanitarian and development industry have to say concerning breast cancer. Please stay tuned. Welcome back to Hude, and now we'll take a look at what key players in the humanitarian and development industry have to say about breast cancer. Let's take a look. All right, here from the World Health Organization. October is Breast Cancer Awareness Month. The month is observed by WHO and organizations and individuals around the world to raise awareness of breast cancer and how it can be prevented and treated. I mean, this is what we need.
Yeah.
Not I mean, but this is what we need. Information, adequate enlightening. Every October, things are being said, things are being done to ensure that information is gotten or given to the right people at the right time. And if you ask me, I think this is just great from the WHO.
Absolutely blessing. Dedicating a month, to each of the cancer depends on any illness at all, shows how dedicated we are towards, eradicating breast cancer.
Yes.
The mortality rates is just so alarming. So, kudos to the World Organization.
Let's move on.
Black women under age 35 are twice as likely to be diagnosed with breast cancer as white women of the same age. Learn your risk so you can make proactive choices about your health. So this says that Black women are twice as likely to be diagnosed with breast cancer, which means we need to actually do a lot in terms of our lifestyle choices, like our guest mentioned, looking at alcohol consumption, while looking at, taking your weight seriously and other proactive choices you can make regarding your lifestyle to reduce, having breast cancer.
So now is breast cancer now color sensitive? Because why do we have to do twice as much? Well, anyways, it's important we know this. This is quite eye-opening because if you know this, you'll be able to take better care of yourself and keep superstition aside. So it's a good one.
Yeah.
Let's move on. All right, we have breast cancer is increasing, particularly in low and middle income countries where the majority of cases are diagnosed at a late stage. Early detection of cancer greatly increases the chances for successful treatment. We've been singing this, we've been shouting this from the very beginning of this program. The fact that most cases in sub-Saharan Africa are diagnosed at a later stage, mostly 5 years after. It's a big problem, and it's the major reason for a very high mortality rate in this part of the world. So we need to be aware. We need to ensure that at least if we get the slightest of discomfort, we're able to go for treatment so that we'll have higher chances of surviving the disease.
A lot needs to be done, in terms of reducing breast cancer rates. And as we've been mentioning, it will always affect those that, from low income countries as well as middle income countries.
Yes.
The HDI says it's even, it's basically what it is. Other countries with advanced, with advanced technology in terms of breast cancer can easily detect this. But in sub-Saharan Africa, we have 5 years disease diagnosis. So it's very important that we take our health seriously, so that, and also the government should do their own bit in terms of providing better healthcare system, providing centers, doctors, paying the doctors like our guest mentioned, doing a lot,
Exactly. Yes.
so that we would not be at the lower level in terms of reducing mortality rates.
Now let's take a look at the final one.
Binge drinking increases the risk of injuries, fetal alcohol spectrum disorders, and some chronic diseases like breast cancer. Providers and patients can work together to address excessive alcohol use. This is exactly what we've been talking about. Alcohol has contributed to 40,000 new cases, globally. So it means that
The EU region.
Yeah, so it means that it's no child's play, and I think it's something that we can actually stop using.
I was just really talking about the fact that the EU region has 40,000 new breast cancer cases due to alcohol. But then, our guest came and she highlighted the fact that we're actually also suffering from that here in sub-Saharan Africa. Just that, okay, maybe ours isn't as much as that of the EU region. Because in the EU region, you have up to 1,579 cases every day. When I saw that figure, I was like, could this be real? But that's what the World Health Organization says. So it is important that we take cognizance and, improve our lifestyle in order to have, a more healthy, body generally and live healthy. Well, before we go today, let's take a look at what the WHO gives as its 3-pillar recommendation for, helping breast cancer. Let's take a look. Okay, so we have health promotion, and it is what we've been talking about. Our guest also hammered so much on that health promotion, getting the information, creating the awareness. So it is quite important we also do that. We have the timely diagnosis, comprehensive breast cancer management. I believe these things go hand in hand. It's like if you're informed, you'll be better informed to, get a timely diagnosis. And after you get a diagnosis, if there are equipment available, you'll be able to, manage everything. So I think it's a great one.
Yeah, it is actually, because timely diagnosis will actually help in reducing the rate of invasive cancers. Because most of the time when people's treatments are, beyond what would have easily, maybe chemotherapy or even just reducing intake of some things, it's due to the fact that they were not able to get timely diagnosis. So the WHO recommending, creating awareness, giving timely diagnosis as well as breast cancer management. And this is for those two that already have it, providing the necessary healthcare services to them, giving them the best treatment possible. Actually is going to be a strong pillar in reducing breast cancer.
Well, we hope we've been able to, create, even if it's the tiniest awareness to you out there, that you should take your health very serious and ensure that you educate anyone around you if you have the opportunity to. If you don't, go to the rural areas, your aunties, your sisters, your nieces there, inform them. Yeah, even brothers, because men are also, likely at a risk of getting cancer. Although it's a slim chance, but then there's still men who have contacted breast cancer. So let's do more. And we hope at the end of the day, the world will be better, at least become cancer-free. Not having that 2050 prediction by the WHO. All right, Jennifer?
Well, like you said it all. The guests have said it all. It is very important that most of the reasons why we are having these breast cancer cases are as a result of our choices. So we should make better proactive choices, and in terms of cases where, it's someone around you that probably is not aware of it, to create awareness in your own little way, inform people. And then also the government should also do their best in cases of healthcare system, providing better healthcare for them, paying the doctors, helping them, so that the doctors too can be motivated to do their job, because most of the reasons why these things happen is because of poor diagnosis of this issue and also misdiagnosis of the matter. So it's very important that, the government take into cognizance all of this.
All right, thank you. We have been together today with
Jennifer again.
And I am Blessing again. Join us same time on the Hude Network for another beautiful edition.